Right. So the inevitable first question, can you see my screen?
Yes.
Hurrah. Second question, is it moving? No.
No.
Okay. Come on. Hang on. Sorry. Always the problem with this. So first of all, while I'm playing around with this, my name is Nikki Glassbrook, and as Ruby said, I work in public health. And actually, it's been really interesting because I thought I was only going to be literally parachuting in to do this presentation. So it's been really interesting to hear some of the discussion before. So come on. There we go. Let's see if now does that. Yes. So I'm going to just briefly talk to you about some of the work we do in public health and around public mental health. So when we talk about public mental health, what we're talking about is the stuff, the prevention side. So all the things that we can do for ourselves to support our mental well-being. So not really talking about mental illness and then treatment for that. This is more that kind of before we get to there. It's the things that we can do to keep ourselves well. And as part of that work, doing that work, we also work quite closely on suicide prevention. So just a message about I am going to be talking about suicide, and I am very aware that for a lot of people that's a very emotive subject. So if that is something that you feel you're unable to, I won't be going into graphic detail, but please do, if you feel that this is not for you, that's absolutely fine for you. I won't be offended if you leave the call or turn your camera off. Because we know that like I say, I don't know anybody's story, but I know that it's a subject that does touch a lot of people's lives. So please, again, this invitation to look after your well-being and put that first. Another thing just to note before we as well is that quite like every other subject, there's a lot of terminology around suicide that might have, been okay at one time, but is now felt not to be that useful. So I'm just showing you this slide and you can look at it in your own pleasure. It's just, again, invitations to think about when you're talking about suicide or thinking about suicide, just to be thinking about language. I think the biggest one there is that quite often you hear people talking about somebody having committed suicide, and I think a lot of people with experience really don't like that expression because it has that sort of legal implication. Obviously, suicide wasn't a legal act in this country until the late 60s, and I think it's just a sort of hangover from those days. All these slides, which hopefully Ruby will share with you, have all the links to all the different resources. Why do we work with suicide? Because we know that suicide can be really devastating and can have a massive impact on families and communities. Although the suicide rate is not as high as it was maybe at the beginning of the 20th century, it is the suicide rate has been increasing steadily since 2018. We'll talk, there's obviously what we look at quite a lot of times is what the risk factors are, what leads someone to take their own lives. That's very complex, but interestingly, and I suppose in relation to some of your work, what we do notice is when the economic situation is poor, suicide rates go up. So we know there really is a correlation between suicide rates and income and levels of poverty. Just so you know what we're looking at here, this is like a lot of public health gobbledygook, but it is showing you that that in Devon, so that's Devon County Council, Devon, we have a suicide rate that is higher than the national average. You can see that Plymouth and Torbay are both coming in with similar rates. So it's a real issue for us to look at how we try to prevent further suicides. one of the things we do is we work really closely with our colleagues in Plymouth and Torbay. So I think this is one area of public health where there's an incredible amount of join up. So we are just going to be, so one of the things, what do public health do? Well, we try and coordinate a lot of activity around suicide prevention. And as part of that, we develop an action plan. And this year, that action plan is actually going to be a shared one for the whole of Devon. We also host a forum around suicide prevention in our local areas, and that brings all the different people together that might be interested and involved in preventing suicide. And because I know you're not all necessarily Devon County Council, there's the links, and there will be links there for the work that is happening with the other councils. So some of the things that we work together on are our training offers. So just to draw your attention to the Zero Suicide Alliance website. I don't know if anybody's aware of that. It's a great website. They provide lots of free introductory training. So, you know, at an absolute bare minimum, it's really worth going and looking on their website and looking at I think they call it takes 20 minutes to save a life, because that's the length of the video. So it's very short, very accessible if you have access to a computer, and absolutely free. The other thing, and sort of maybe talking about some of those stresses, is Connect 5. So we promote a training course called Connect 5, and we fund Connect 5. So it is free for people to take. And what Connect 5 does is it focuses on well-being. So it's about having those well-being conversations that are connected and, you know, and trauma informed. But also what I really like about Connect 5 is it actually does focus on the carer and how we can look after and support our own mental health and well-being. And I always think that being able to have conversations about mental health, being able to have those connected conversations with other people, for me, is also a bit of a workforce tool, whether that's paid workforce, volunteers, you know, because people can be having those, not just those conversations with people that maybe are coming into the food banks or the places where you volunteer, but also among yourselves, you know, peer support, peer-to-peer supporting each other. I think there's a lot of sometimes mythology about, you know, people need a mental health assessment, or, you know, there's a mental health problem. And I'm sure in your work, you know, that sometimes people just being listened to and feeling heard is massive. And being able to listen to somebody, you know, fully, without judgment, and without maybe always jumping to a solution, but just listening is just, you know, a really big therapeutic tool that doesn't take a lot of expertise or, you know, a degree in clinical psychology. It's just being human, which I'm sure you already know. And then we also fund something called Assist. So this is it's a 2-day in-person training around suicide prevention, and it is an American, well, it's Canadian actually, course, but it is seen as the gold standard, and so we do offer free Assist training as well. Obviously, there are other training courses out there. Samaritans have a range of courses. Papyrus is a charity that focuses mainly on suicide prevention for younger people. And Pete's Dragons, has anyone heard of Pete's Dragons? Yes! So Pete's Dragons is an absolutely fabulous charity that we work with, who provide bereavement support, you know, for anybody who's been affected by a suicide. And the reason why we focus on that, because you might be thinking, well, that's not prevention, but actually we know that, again, one of the things we do know is that if somebody's been bereaved by suicide, it does increase their risk of ending their own lives by suicide. And we know that getting appropriate bereavement support, you know, at timely, is absolutely key to supporting people's well-being. And Pete's Dragons, they operate on a no waiting list basis. And even if if you feel that that person took their own life, then they will support you, even if at the end of the day there's an inquest and that's not ruled. So they will actually see people, and they work very closely with children charities to support children as well. Another offer that we have is myself and my colleague Natalie, who sends her apologies she couldn't join this afternoon, but we are more than happy to come either in person or produce a webinar or join a meeting and talk to people about a bit longer. We can do a longer, shorter, we can really do a bespoke presentation that covers some of these areas around suicide prevention. So that is another offer. Like I say, we're more than willing to come out. We're just linking in because somebody talked about farmers, and we do know that that's a potential group that we're really wanting to engage with. So we're working with a couple of voluntary groups and the university to link in and support, do some support for the farming community. But we're available for hire should anyone wish. We also have oodles of resources that you might want to put in your food banks or your cafes and everything. So we've got a leaflet called "It's Okay to Talk About Suicide," because some of the people think, oh, if you ask someone if they're feeling suicidal, you're going to put an idea into their head, and that's not the case at all. And it can be really overwhelming and daunting if somebody opens up to you and says, I'm feeling really suicidal, or I can't see a reason for going on. And this is hopefully give people a bit of confidence to be able to open up that conversation. So again, some people say, oh, if it's a cry for help or it's a cry for attention, but also maybe it's the first time that somebody's actually vocalized that idea, that thought, and are really kind of asking for help and time to discuss their feelings. And again, there's really good advice in the booklet. Obviously, if you're really worried about somebody, there are crisis lines, but there's also conversations that you can have with people. So we actually devised that leaflet with people with lived experience. So people who actually either bereaved by suicide or have had experienced suicidal thoughts in the past. So it's a really good, and we have got stacks of them. We've got ones that because there's a QR code on the back that actually gets you into resources, and they're tailor-made for Plymouth and Torbay as well. So we've got one especially for Plymouth and Torbay. We've just also, before these slides were done, we've got these little safety plans as well that people can use. So safety planning, for those that you don't know, and it's a really good thing to do with people, not when they're in crisis, because I think people need to be not in crisis to do a safety plan, because what it is getting people to think about the things that keep them safe in their lives, the things that make life worth living, for want of a better phrase. And then it's there for them when they are when they've hit rock bottom or they're feeling like they're in crisis. It's something that they can return to, or somebody who's supporting them can return to. So we've now got quite a lot of those very quick and simple ones. There's masses that people can go online and download, but we just thought a really simple one, again, that somebody can keep in their wallet, or that that's handy for when they need it. And then there's other resources that we can access. So Devon Partnership Trust have written a letter of hope. So again, that's written by people who have attempted suicide in the past, and I'm writing a letter to somebody about that. And there's also something called Help is at Hand if people have been affected by suicide. And also there's support for people who may have been a bystander or a first responder. Crisis support, Pete's Dragons I've talked about, and we've also got other resources, so promoting well-being. These are online resources, but there's Every Mind Matters, which again gives helpful ideas about helping to keep ourselves well, mentally well. There's Calm, so that's the campaign against living miserably, I think, is the again, I think a lot of those resources are aimed more at men because unfortunately in the world of suicide and suicide prevention, we know 3 times more men end their lives by suicide than women. And then Young Minds, again, is resources for young people. And then we also have our own, again, these are resources. We've got these on postcards and posters. Is anyone familiar with the 5 Ways to Wellbeing? You might notice it's also my backdrop. So it's again, it's an evidence-based way of understanding how people can support their own well-being. So, you know, connecting, being active, learning, giving, and taking notice. And this week, on the 10th, it's World Mental Health Day, and I know Devon County Council are running a bit of a campaign with Active Devon. We're focusing this year on the importance of connecting with nature and being outside, and how that links into the 5 Ways to Wellbeing. But again, those are resources that we have and are available if there's something that you think would be useful to have in your project. And that was a very quick whistle-stop tour, but if anybody's got any questions.